Well, another common question that I get asked, and probably what people should ask, is how long do implants last? Unfortunately, a lot of people have been doing implants for a few weeks or a couple of years. I haven't been around long enough to see all the complications and even understand the question. An implant has two areas of complications. One is a biological complication where your tissue or bone doesn't stay stuck to the implant. So the implant can actually last forever, but your tissue doesn't. So that's what we call a biological complication. The other one is a mechanical complication of the crown or the screw or the resin restoration, where things can chip or break. I'll just try and explain some of those. Now, there's been a lot of companies will make all sorts of statements and claims about success of implants, so they have a 98% success rate, and you'll see these statements. But implants are good, but they're not that good. They do have a higher complication rate than 2%. It's misleading because that 2% is just really the rate of implant loss at an early stage. So up to about 5 years, you'd expect probably 2 or maybe 3% of implants to be lost, and therefore that's where they quote the 98%. But there are many more complications with implants in terms of restorations and things coming loose and things chipping. Now I'm just going to quote two studies which are very informative. This is the Dirk study, 2016, and this is an Adler study, and both of these looked at a large number of patients in Sweden. Now Sweden provides a lot of data simply because they record, the National Health Insurance in Sweden pays for a lot of this treatment, so people have access to the records and can collect data. So Dirks went back and looked at the implant success rate of some thousands of patients and actually reviewed nearly 600 of these and examined them with, for bone loss and tissue inflammation, and looked at the cases in more detail. And Adler reviewed the satisfaction rate. So although implants have a complication rate of about 33%, most people are still very satisfied with their implant treatment. Now, out of the Dirk study, there's a few highlights that at 9 years, 3% of implants were lost. So they came up with a 3% loss of implants. But they had 7.6% of patients had lost at least one implant. So if you had a large number of implants, if you had an all-on-4, a full arch reconstruction or a couple of bridges, you're actually at much higher risk of losing an implant. So 7.6% of patients had lost at least one implant in 9 years. The studies tended to show that, and again a European Association of Osseointegration agreed that about 33% of implants have some sort of complication that refuse. And I'll explain those complications to you in a minute. Most of these can be resolved, but you need some attention. You need to ideally see the person provided the treatment. So you need to be close by, an hour or two away at the maximum from your provider, because in the best of hands, in highly trained Swedish professionals who invented implants basically, where 80% of the surgery is done by specialists and 80% of the restorations were done by general dentists, 33% had some type of complication. Another interesting fact that came out of the study, that if your restoration was provided by your general dentist, you had 4 times, or 4.3 times, the complication rate than if your restoration was provided by your specialist. So there's much higher rate of complication than when general dentists were restoring implants. So again, at the end of the study, the satisfaction study, they came up with a number that 600 patients, 81% at 8 to 14 years were highly satisfied with the treatment, although a third of them had a complication. They're still highly satisfied with the treatment. Another 13% were mostly satisfied, bringing up the mostly satisfied group to about 94%. So 6% of people weren't very satisfied with the treatment. But this treatment was provided by a specialist clinic, specialist surgeons, not by newly trained general dentists doing treatment.